Well, hello, hi, welcome back to my channel. This is glitzzygem, and thank you for watching. First off, I wanted to say, how is your day going? How's your week been? Hope everybody's had a healthy week. Hopefully everybody's been well. I send all my prayers and wishes to everybody, to all my viewers, to make that y'all are well, because I had a rough week. No rest, been sick. I went to the doctor yesterday. I had a sinus infection. They told me I needed to be on sinus medication and nasal spray. I'm still trying to get over it. I feel much better than I did on my last video. I feel a lot better. But I am still having problems breathing. I feel like I get out of breath. I went to the doctor and I mentioned that to them, and I told them, that I've been feeling out of breath lately, and I don't know what it's, why it's doing that. So they want to send me to an ear, nose, and throat doctor to see if it has anything to do with, my respiratory area, why I feel like my heart, because my heart's been fluctuating. It's been going high. It's been going up. And I've been trying to, I would calm down, and I would I don't know how to keep it from rising. It just rises, and I could just be standing here with you right now, and just all of a sudden my heart just rises. I don't know, maybe if I get overexcited, and with the symptoms that I'm having with my sinus infection, kind of maybe spikes my heart pulse, my pulse rate. It might spike that. So I don't know, but I did wanted to make this into a little mini geek session and let y'all know about some of the medical equipment that I keep at home, because there were points in my time in the past where I had low blood sugar, I had to check my blood pressure, and I had to check my pulse, because okay, so there's stories behind all those. Okay, so for my pulse, the reason why I needed to buy a pulse oximeter is for the same reason, was that I kept feeling out of breath, and I wanted just to monitor my oxygen. So I bought a pulse oximeter, and then I also wanted to make sure that my blood pressure was, stayed normal. Just wanted, just to keep an eye on that. Oh, and because of my, medical history, that I have, I'm borderline diabetic. That's why I have a glucose meter as well. I'm borderline diabetic. And I know that, borderline diabetic people don't necessarily need a glucose meter. They just need to watch what they eat. But I am going to be very cautious and precautious about that. So I am that type of person. I'm sorry if it kind of if anybody's like, oh, that's kind of just too much or whatever. I am too much. I'm extra. I'm too extra right now. Too extra when it comes to my health. So I have a glucose meter to check my sugars, to make sure that my sugars are normal. I have a blood pressure monitor. My blood pressure's never been high, but I only got it because my family, my parents, they do need a blood pressure monitor, so I bought it for them, but it was mine. So I actually told them, okay, I'm just letting y'all borrow it, and then from time to time I would check my blood pressure, because it's something that we need to concern ourselves about as well. As people, we need to concern ourselves with our health. So I would use that, and I bought a pulse oximeter for the same reason that I was feeling out of breath. And I don't know what the reason for that was. Can't remember, what was it. I think I was having some type of hypersensitivity to an antibiotic I was given for bronchitis or pneumonia. I'm not sure. Supposedly the doctor said, I had pneumonia. They did a culture. This was years ago. Not now, but years ago. They told me that they did not a blood culture. They did a sputum culture, of your phlegm. and that it was forming pneumonia. I hadn't had it yet, but it was getting there. So they prescribed me an antibiotic, and I started to feel out of breath. They gave me steroid shots, you know, to make me feel more relief from my lungs. So me being extra, I went and bought me a pulse oximeter. It looks like this, and I carry it around with me everywhere I go. I leave it in my purse. I also have a bag of medications like Benadryl. I'm hypersensitive to Benadryl, so I don't take Benadryl, but if in case of an emergency, I don't know, maybe I might be more likely to take it if I need to. But I keep it around in case anybody else in my family or friends, co-workers need Benadryl, something for their allergies. I keep that in I have a little satchel, like a little lunch bag. I have, what else do I have? I have my glucose meter in there. I have my wrist. I bought a wrist blood pressure monitor. I don't keep this in there. I keep this with me in my purse, because sometimes from time to time I do want to check how my breathing is, and maybe this is where a lot of my symptoms are coming from, and it's probably just all in my head. But I don't know. I am a skeptic about that, because everything's not always going to be in my head. You know, everything's not always, all the symptoms that I experience, all the sensitivities to medications, that's not all in my head. So I don't know. I don't know. I just don't like, I'm not going to say that. Okay, I'm going to say that 100% is not all in my head. You know, I'm going to say maybe 20% is probably all in my head. And the doctors, you know, they go by that and they tell me, you know, why do you have this? Why do you have that? And they're like, you're just worrying too much. You're worrying about yourself too much. And I'm just the type of person. I'm just extra when it comes to my health. I want to be healthy. So anyways, I'm just rambling on, but so I wanted to show you the pulse oximeter, because today I've been experiencing and yesterday I've been experiencing a lot of like my pulse rate has been fluctuating. Has been like on the high side. It's been rising. It would rise on the high side. So to be precautious, I would put this meter on, and it would let me know how much oxygen I'm breathing in, and at the bottom it'll tell me what my pulse is. So I'm going to show you that right now. So there's a little button right here, if you can see that. There's a button right here. You click on that, and this is just getting it started. And when you see those lines, you just stick your finger in there, and in a minute, on the top left corner, you're going to see the battery life, you know, how much life my battery has. And then now you can see that I'm breathing at 96%, which is low. I'm supposed to be at 99 or 98, and this is 96. And then my heart rate is at a 97. That is high, you know, especially for somebody who's not doing a lot of activity. But I'm leaving it on there for a minute. As you can tell that the top number, the 97, is starting to go up a little, and the bottom number is starting to go low. It does take a little while maybe to get an accurate reading, but there it goes. 98% oxygen and 94 pulse rate, and that's high. I don't know why my pulse is high, and it's probably maybe because of my symptoms. I still have congestion in my nose, having a hard time breathing, and I think it's overworking my heart. And this is a concern of mine, because look, it's just rising. So I know this is not just all in my head. You know, look. I'm fine. I'm normal. I'm not panicking. It's not nothing in my head. And look, the numbers are right there. Numbers don't lie. So this is where I'm frustrated with my doctors and people who tell me, oh, it's just all in your head. You know, there's nothing wrong with you. Look, now it's going up to 100. You know, I don't understand why look, 101. And I'm just standing here. I mean, come on. And I know taking deep breaths help, but sometimes it doesn't. Look, it's just rising, and my oxygen is still, I don't know, I've been having problems with that, and this is not normal. This is not normal. So I'm worried. So I'm gonna pause this video and I'm gonna show you my wrist blood pressure monitor, and I am going to show you the one that I use at home, like the home pressure monitor, which is more accurate. And then I'm also going to bring the what was the other one? Oh, my glucose meter. I want to show you the glucose meter and how it works and stuff like that, you know. Okay, so I'll be right back. BRB. So here I am. Here's my bag. Sorry, I'm sitting trying to get myself comfortable. So here we go. So first off, I wanted to show you the wrist monitor that I have in here. I have alcohol in my bag here, and this is my glucose meter. It's in a little zipper case here. You can see that. Oops, that fell. Oops, everything's falling. I didn't secure them in there all the way like they should. So I feel so comfortable like this. Hopefully my pulse goes down. Just resting, lying like this. I'm sorry. Okay, here we go. Here for a purpose. Okay, so here is my glucose meter. It comes with some lancets. This is the glucose meter. I call it the finger pricker, or pricks your finger. And then I have this side, I have like some test strips to tell you how much, you know, how high your sugar is. And I'm gonna show you the lancets. Okay. This is very convenient how I made my sickness issues into a Mini-Geek medical video. Okay, so this is how the lancets look. See? And when you open this up, I can always put it back. When you twist this open, you have to twist and twist and twist, and there you go. You're gonna see a little needle. I think you see the little needle on there. Well, I'm gonna put this back, the needle back, because these are precious. These are expensive, and so are the strips. The strips are very expensive, so I need to not be wasteful of these. Where did it come out from? Here. Well, yeah, I'm not going to be wasteful of these lancets because they're expensive. This feels comfortable. I want to see how my pulse is. See, I want to see how my pulse is now. Let me see. I just feel so comfortable right now. Okay. I feel relaxed and comfortable. So maybe my pulse has gone down already. So here we go. And here we have it. My pulse is going down. It's in the 80s now. My oxygen still needs to rise a little, but that's because I'm speaking and it's at 95. Oh, that's normal pulse right now. See, it fluctuates. I'm telling you. Right now I feel so calm and relaxed, but then all of a sudden, I don't know, it just starts to fluctuate. But basically, what you do with this, that lancet, you put it inside your finger pricker. I call it finger pricker. This is a Walgreens brand. You can see the needles already in there, and the way you just put it in there. You see this one has like little grooves. Little grooves. You see those little grooves in it? You have to just put the groove inside these groove holes. So let's groove that in there. And then you have to push it in once you put it. You see how it pops up? That's what pricks you. At first I was very uncomfortable, like, oh, I don't want to use it. So now you're going to put the top back on. And this top tells you like at what setting you want it. It goes all the way to 4, I believe. No, it goes all the way to 5. I've never had to go that deep because my skin is very real. I guess what I'm trying to say, I guess my hands are not callous. My fingers are not callous. So I have it at the 1 setting, because with the 1 setting you can actually get blood out of it. Sometimes when they are callous, I think the highest I've gone is to a 2. That's it. But I have people, yeah. So yeah, they do prick you deep. So that's that. That's the finger pricker. And then this here is the test strip bottle, test strips. And the test strips look like this. Oh, they come like, I don't know if I showed you. Did I show you? I didn't show you in the camera. Okay, well, I flipped open this cap and then I just took one of the strips out, and I have not so many, and these are like gold, so I cannot be wasteful with these. So this test strip has a metal microchip at the top, as you can see. At the bottom is where there's a plastic, there's a clear plastic, and at the right here at the end is where you would stick your blood when you would prick yourself. So this microchip would be inserted into your glucose meter here. My glucose meter is set, it's a Walgreens brand. So my glucose meter is set to where when you insert this here, the chip, the microchip inside the glucose meter, it turns on by itself, you see? Turns on by itself. And now it's asking me to put blood. So what I would have done, I would have pricked my finger and I would squeeze blood out, and then I would put it inside the hole. And there's a clear, I don't know if you can see, but you see that like grayish looking bar at the bottom? Well, there's a plastic over that grayish looking bar, and that's what tests your blood. And it tells you how high your blood is. There's this, what was I going to say? There's this, I don't know, I guess you can call them myths, you know, or theories. There it is, theories. That's the word I was trying to say. There's theories that if your blood pressure, your blood sugar is high, just sucking on a lime wedge would bring your blood sugar down. So I guess that's a little trick there. I don't know if it's a hoax. I mean, not a hoax, but because it's worked for some people. Like my mom, for one, she relies on lime wedges whenever her blood sugar is really high, because she really does get high blood sugar. So she just sucks on it, and I think it helped me because my sugar was high whenever I tested it earlier, when I started to feel like I needed to take deeper breaths, and I was wondering, okay, what is it? You know, why is my pulse high? Why is it going high? I know I'm draining, and then at the same time I'm thinking, okay, I'm checking my blood pressure, and then I'm checking my sugar. So when I checked my sugar, it was high. So I did take a little piece of lime wedge, and I just sucked on it. And that's another remedy for not just your throat whenever you have like irritation in your throat or anything like that, but it also helps you with your blood sugar, because I think my blood sugar's gone down, because I don't know if it's gone down, but anyways, have tested it before though. Yeah, where I would do the lime wedge, and then I would, you know, check my blood again, and it would be lower. So, and I know doctors will tell you, well, that's what your body is supposed to do. It's supposed to lower your, I mean, not the lime, but your sugars, they fluctuate. So they tell me, you know, could have been a coincidence, you know, that your blood sugar just went down by sucking on that lime wedge. But, you know, it's not just always all in my head. Like people say, it's all in your head. So I had that, and I wanted to show you the, also I have these little sanitizing hand sanitizing wipes, because sometimes I'm like I'm not going to say I'm a germaphobe, because I don't use them all the time. I forgot to mention that this alcohol is for to check my sugar. So what I do is I put that rubbing alcohol first on my finger, and then I prick it, and then that's whenever the blood comes out. So that's the reason why I have the alcohol in there. I used to have a history of asthma, but this is the inhaler I use. I haven't used it, and I mean, I just carry, I'm extra, I'm telling you, I'm extra. I carry stuff for emergency situations, and, you know, I don't need them. I have some of the stuff I just throw away, but I buy some more, and maybe that's just all in my head. But it's good to always be safe than sorry, so that's why I buy this stuff, you know, because just to keep on hand, because you just never know. Anybody, not just myself, but anybody that works with me, anybody, any friends, you know, family members may need some medicine, like the Benadryl I was telling you about. The Benadryl. I got the children's Benadryl, and I don't take it. I used to be okay with Benadryl, but now I don't know, chemistry in my body just changed, and I take Benadryl, and I just start to feel where I feel like I can't swallow. I start to feel a little hyper, like I can't sit still. So I said no to Benadryl. And then this is my my wrist monitor. And I have them all in these Ziploc bags, just so they won't touch each other in case one medication bursts. Like this one's in a box, but everything else in my bag are in plastic Ziploc bags. So if that if that medicine ever spills, and it seeps through the box, it's just gonna seep into my bag, and I can always just wash my bag and always use new Ziploc bags to put the medication in there and protect items like this, because these are expensive. And excuse me, I'm sorry. Protect items like this, because these are expensive. They can be very expensive and pricey. This is my wrist monitor, and I take the battery out because batteries are precious too. The longer you keep batteries in a medical equipment, it tends to die out. So I just take the battery out, and I just put batteries in there whenever I need to use it. So I don't think I'll have to demonstrate how to use this. Oh well, I'll show you how to put it on. Like, excuse me, I just got dust in my throat. Okay, so yeah, I put the batteries in there, and then I just put this wrist monitor on with the machine facing me like this, and then when you want to start, it has a start. When you want to start, when you hit the start button, it'll start, and you'll start hearing the noise, you know, where it starts getting. You want to always you always want to have it near your heart. So sometimes the nurses will tell you, okay, when they have these kind of wrists, they'll say, well, put your arm across your arm, put your arm across your chest like that, and then once they get the reading, they can just read the reading off the wrist monitor. But the best monitor that I can say that I would recommend everybody to have at home is just a regular cuff digital, the cuff digital monitor like this. Oops, I don't want to knock y'all over. I see my bruise. I'm so sickly and injured and all that. Like I was saying about this blood pressure monitor, I used to have the I don't know where I have the one where you have the stethoscope, and what it is whenever it's the one with it's the one where you put the cuff around your arm, and then you put the stethoscope, okay, you put it here on your wrist, and then, well, it already has a stethoscope already on the cuff, so you always want to put the stethoscope on top of, you know, where your inner elbow is. You always want it to be right there. That's where your main artery is, and that's where you want to, because that's where you're going to hear your heart. So when you just pump, and you put those, the ear plug, well, not earplugs, but the, I don't know what the term is, but they look like earbuds, and then, well, that one is connected with the one that's you're gonna have to hear your heartbeat. So when you pump, you don't hear a heartbeat yet, you just keep pumping, and then there's a little monitor that tells you your mercury, MMHGs, whatever, I can't remember the term, but it's MMHG. And so when you pump up and you hear your heart, then you okay, that's the number you write down for the top number. And then whenever you start letting the air out, you know, at the top of the pump there's a little twisty cap, where you just twist it, you know, slowly to let all the air out. And once you start letting all the air out and you don't hear the heartbeat anymore, that's the bottom number. That's the number you put at the bottom. So yeah, that's how to use the old fashioned manual pressure monitor. But I like the digital one because it's faster and accurate, and the most accurate one is the other one, the original, the manual one. But I don't know, whenever you want to get your blood pressure in a hurry, this is what I use. But if I don't have this anymore, I always have the other one as a backup, and I always check somebody's blood pressure just to make sure how high it is. What else do we got in this baggie? That hand sanitizer, my asthma meter thing, my glucose meter. I carry candies and cough drops in here, and the reason for that is because the cough drops help me with if I have any cough or irritation, irritation in my throat, and these cough drops are good. I mean, I would recommend these cough drops to anybody. Is the Ricola, the honey mint one. Oh my god, that's the one that I use, and I recommend people take them because I'm always having allergy irritations, and with me having sensitivity to medication, it's just, yeah, it's just take my word for it. And then I have these lifesavers whenever I feel like my blood sugar starts to go down. I heard lifesavers were the best candies to have whenever your blood sugar goes low. What else do I have here? I have epinephrine. Yeah, I don't want to give you my information here. I think y'all saw my information. And I'm going to show you how the tubes look. There's 2 of these in a package, and these are very valuable. This is like gold as well, because these are lifesavers. You want to twist open, pull out, and then you want to stab your thigh, and it it starts releasing the epinephrine in your thigh. This saves lives whenever you have anaphylactic allergies. So I'm very careful in not using this. I never used it before. It's a natural. We all have epinephrine in our system, so I don't think I'll have a hypersensitivity or allergic reaction to this. I hope not. Oh my God, that'd be horrifying. My goodness. I feel like the girl that needs to be in a bubble. But anyways, so, and also learning CPR is a good thing. First aid and CPR is a good thing for everybody to learn. And that's, I took a class on that last year or 2 years ago. I was in 2013. I think it was in 2013 when I took the last class. So I need to renew my certificate. I need to go back and take classes again on CPR and, you know, and first aid. Okay. My next thing I have in here are cortisone creams. And what these do is they help you with, like, if you have a rash, because I tend to break out in rashes. But sometimes, well, they tend to break out, but then they go away within 5 minutes or less. Now, like this one here, where I just kept scratching and scratching and scratching, I should have just put some of that hydrocortisone, and that would have been relieved. That itch would have been relieved. But I'm very skeptical about putting any kind of medication on me, but not these. Like, I can always put these on, but I just feel like sometimes I just feel lazy, and I just like, if it's not really bad, I don't put it on. What else do I have in this bag? I have some Zyrtec. The reason why I have this is because this is the only one that I know of right now so far that gives me the less side effects or less symptomatic problems whenever I take it. If in any case I need to take an allergy medication like the doctor told me, I need to either try Zyrtec or try Allegra and use that Flonase for your sinus infection. But I am so, like, extra, like, we're like, not extra, well, I guess extra is not the word, but I am so like a worrywart, and I would wait a long time before I feel like I should take any type of medication or any kind of nasal spray. I'll just wait it out, let my system fight it out, drink plenty of fluids, water, eat well, rest well, and I'll just let my body just fight it off. And if after a while it doesn't, and it starts to become a problem where you know, that I'm always feeling sick, I'm always having these sinus infections, or it's not going away, then I'll resort to my medication. So, but that's all that's in this bag here. That's all that's in this bag here. It's just let me take the stuff out. It's just a, you know, like a cooler lunch bag. And I liked it because I like the design, and not only that, it's, you know, very, you know, you can carry it around with you. So that's the reason why I bought this bag. But I think this concludes my little mini geek session when it comes to medical supplies. I also stay tuned for my next video that I'm about to do, if I have a chance to do it. It's on fixing broken makeup. We have a lot of, there's a lot of cosmetics that end up broken, like the eyeshadow palettes. Sometimes you might drop your eyeshadow palette, or you just might buy eyeshadow palette that you know, maybe one color is broken, but you just love the palette so much, you just want to buy it. And that's what happened to me. I went to the store and I got me, you know, to add to my haul collections, just add to my cosmetic collection. I got me, there was 2 eyeshadow palettes that I got, and on one of them, I think the last color, it's a real pretty blue color, was broken. So I got a discount, like I got 5% discount on that, because it said, you know, it's just one color out of all the palette, and the palette's still nice. It's brand new. They're like, all they can do is just take off 5%. So I wasn't very happy about the 5%, but I really was like wanting the palette, so I went ahead and I got it. And I took the 5% off. The other one, which is not bad, because I think the palette only costed me $5.99. I'm not sure. I'll check the price on it. But there's another palette that one of the colors was not broken all the way, but but towards the bottom of the color, because it's one of the ones that are the rectangular shaped, what do you call those, tray? Yeah, the trays that are inside the eyeshadow palettes is the rectangular metal tray. So at the very bottom of the metal of the color, it was broken. Like it was broken. There was no extra. The extra piece that broke off wasn't there. It was like, I think, kind of like spread up. I think it just kind of like just spread up throughout the, you know, sometimes it has like a plastic covering. Well, I mean, they have a plastic covering, so I think it just kind of smeared into the plastic wrapping, you know, that color smeared through, not on the colors, but it just on the plastic wrapping. So I think that's where the extra paint went, the extra powder, extra shadow went. So I'm going to try to see if I can kind of like accumulate it off the plastic film and put it together, and then I'm going to try to fix it. So stay tuned for that video, okay? That's another video I want to do to show you how to fix broken makeup eyeshadow palette, in this case, because you can also, anything with powdered cosmetics, you know, eyeshadow, blush, highlighters, even pressed powder, foundation, you know, whatever. You can, this is a hack you can do to fix your makeup. Alright, so stay tuned for that. I love you guys. Thank you for watching, and I'll see you gems later.